We're talking with Dr. Martin Parker, who is the chair of radiology here at JFK. Doctor, first of all, it's great to see you, and we're looking at
It's good to be here.
we're looking at just a little bit of the technology here. But what makes the radiology efforts here at JFK stand out in the marketplace?
Well, we've got a number of unique approaches to optimizing patient imaging. We've reduced radiation on our studies to the absolute minimum that permits us to get excellent studies.
How do you do that?
Well, we've eliminated non-contrast portions of our examinations. We use routine breast shielding for males and females.
Well, back up. What exactly is a routine breast shield? I don't want to assume everyone knows what that means, Doctor.
Well, what we've been able to do is acquire a blocking device that reduces the absorbed radiation to the body whenever we scan the chest on any of our patients. And what it's done is significantly reduces the absorbed dosage to the patient.
What exactly are we looking at right here, Doctor?
Well, there is a portion of a CT examination of the chest, and we're up at the top of the aorta, the large vessel in the body, and in fact, that's a perfect area where this breast shielding substantially reduces the absorbed radiation to the patient.
Now, my question is everyone doing it? Is it just JFK? I mean, where do you stand in the market?
Well, I think everybody has the opportunity to do it. I'm not sure everybody has really instituted this as a routine. To us, reducing radiation is a critical portion of our patient care.
Why is it so important?
Well, absorbed radiation is cumulative over a lifetime, and it's extremely important that that be minimized to reduce tissue damage and any adverse effects.
Let me ask you a couple other things. As I was getting ready for this interview, I thought, okay, what does the future hold for radiology? Where are we going in the future, Doctor?
I think the future will consist of perfecting many of the techniques that we currently have and advancing MRI non-radiation imaging, which is one of the strengths here at JFK. We're one of the few places in New Jersey with a high field, a mid field, and a low field.
What does that mean?
That's the strength of the magnets. So we have the entire gamut of MRI strengths to optimize imaging and tailor it to the patient's needs.
You know, it's funny. Before you finish the interview, I'm curious. How do most people find out about what makes radiology here different at JFK as opposed to any other place? How would they find that out?
Well, I think that it's important that they speak to their physicians. We have 1,000 physicians on staff who practice throughout the central Jersey community, and they need to make their patients aware that this is the place to come for optimal imaging.
I've asked every one of your colleagues this. I'm going to ask you, Dr. Parker. What is it that you really love about what you do?
Well, I think this is an opportunity to apply the most interesting science to patient care in a way that's continuously changing and is endlessly fascinating.
Challenging and rewarding at the same time.
Absolutely. This is a field that's blossomed over the last 20 years in a way that no other areas of medicine have.